link this discussion with this morning's panel discussion. There was a lot of things that were touched upon on the power dynamics, on collaboration versus cooperation, on the role of diaspora and local actors in the response, and how institutional humanitarian actors engage with them. So I think this would be really interesting to continue in that sense. Maybe as a good practice to also make it more participatory, I actually would like to have a run of quick introductions, so also the panelists know who is in the room, and then I feel it's a good way for then everyone to also participate. So maybe Jawahir, you want to start?
Good afternoon, and I'm Jawahir Dahir, and I am from UK. I'm chair of Global Somali Diaspora, who actually provides platform to Somali diaspora globally.
Good afternoon, everybody. I'm Ahmed, originally from Syria, well, son to Syrian refugees, born and bred in Glasgow, and I'm from Wipe the Tears, we're a charity that works with Syrian refugees and network with other Syrian charities.
Good afternoon, everybody. My name is Roberta Romano. I am a diaspora engagement consultant with the International Organization for Migration.
Hello, I'm Andrii. I'm the representative of the Ukrainian World Congress and responsible for humanitarian questions, and I'm the former president of Caritas Ukraine for 20 years.
My name is Victor Hetmanchuk. I'm the chair of the Canada-Ukraine Foundation. We've existed since 1995, and I was there at the first day of the war in February of 2014. So this is not a new war, this is the reigniting of the old war. Okay, no.
Hello, I'm Alexandra Pustova. I represent Foundation Our Choice, Ukrainian House in Warsaw.
Hello, I'm Malvina Quayson. I'm the Diaspora Engagement Specialist with the International Centre for Migration and Policy Development, and also used to work with DEMAC in the first phase.
Hello, everybody. My name is Asef from ABOT, a non-profit and based in Berlin, and working for empowerment of vulnerable communities. I'm working more on Afghanistan issues, but now I'm here to compare actually the issues between two countries.
Oh, perfect timing. Hi, everyone. My name is Kim Scriven. I'm the director of the H2h Network, which is a network which supports organizations that provide services to the broader operational humanitarian response environment. So our members typically provide services to support INGOs and UN agencies. And we're also hosted by DRC, and DEMAC are also members of H2h, so there's lots of relationships as well.
Hello, everyone. My name is Rabia Nasir Habib from the Foundation for Refugee Economic Empowerment, FREE for short. I'm also on the advisory board for DEMAC.
Oh, hello. My name is Daria. I'm together with DEMAC, Emergency Response Officer. So I work together with Ukrainian team, so yes.
Hi everyone, my name is Chris. I work on emergency response with DRC in its headquarters, Copenhagen, and also on the advisory board of the DEMAC project.
Lots of DRC members. I'm also working with the Danish Refugee Council, and I coordinate the humanitarian disarmament and peace building sector of DRC, which was formerly known as DDG for those who know DDG more. And I'm based now in Geneva.
And I'm Nick Van Praag, and I was speaking this morning.
Thank you all very much, and looking forward for a very constructive and interesting discussion. So to introduce this session, we've seen that Ukrainian diaspora organizations have been extremely active since day one of the conflict. We have some representatives here of these organizations. They have been expanding in scope of their activities and in scales. Foundation Our Choice is a great example of that. In Poland, they have very large operation now. It's focusing on humanitarian response. We've also seen that Ukrainian diaspora organizations have been able to respond in all areas of Ukraine with their local partners, while institutional humanitarian actors were still reorganizing themselves or maybe mobilizing resources. And we've seen also a capacity to fundraise and to mobilize resources, which was extremely efficient as well. Within the first week of the conflict, we've seen dozens of millions of dollars raised around Europe and the US, which was really impressive and unprecedented. And finally, DEMAC has been also kind of developing a new activities and role by deploying operational capacity with some dedicated staff in Ukraine and in Copenhagen to support the diaspora efforts, trying to help in terms of coordination and collaboration as well with institutional humanitarian actors. So today we'll be interested to hear what we can learn from this crisis in Ukraine, and maybe what can be replicated in other contexts, what make it also unique, and we can take as learning from this specific context. To talk about this very interesting session, we have three panelists. Emily Savage, she's the co-founder of Meraki Labs, a researcher. She's been leading on the last real-time review that DEMAC has just released last week on Ukrainian diaspora organization humanitarian actions. And she has been in the field of humanitarian response for the last 10 years in different capacities in Africa and the Middle East. Then we have Andrii Kuzmyn, who is the chair of BEVAR Ukraine, one of the most active diaspora organization in Europe, who has been really engaged in providing direct humanitarian response in Ukraine, but also in supporting refugees arriving in Denmark. And he's also one of the, sorry, you're on the board of, I forgot.
Of Ukrainians in Denmark.
Yes, thank you. An umbrella organization of different Ukrainian diaspora organizations in Denmark. And finally, Dina Volynets is currently the DEMAC Liaison officer for Ukraine, supporting the Ukrainian DO humanitarian response efforts. And she's also been involved previously in a case study that we did last year also on Ukrainian diaspora organization humanitarian response. So she worked also as a consultant in various capacity. And before that, she's been the NGO Forum coordinator in Ukraine in 2014, 2015. She also has the NGO perspective. So without further ado, we'll start with the first question for our panelists. Oh, sorry. And my first question is actually to Emily. Thank you. Emily, based a little bit on the real-time review you've been working on, could you tell us a little bit what makes diaspora organization humanitarian response maybe different from other crises? And if you can also tell us a little bit about how Ukrainian diaspora organizations are structured, how they work. Tell us a little bit about the key finding of your report.
Yeah, sure. So maybe just to start, so the real-time review that was conducted started on February 24th and then ran for 6 weeks. So a lot of what I'm going to talk about is just, within those parameters. For that study, we mapped about 60 organizations and then sampled a smaller group of about 20 to follow up. So again, just couching my responses in kind of the methodological limitations of that. But just to say, I think like what our colleague had mentioned previously is the response is a bit unique in that a lot of the organizations were already active in Ukraine, responding to the humanitarian situation in eastern Ukraine and had been there since 2014. So I think that there was kind of a different setup. A lot of organizations were founded in that period in a direct response to the 2014 conflict, had already established connections with the local governments, had already made connections with healthcare facilities, and also had very strong advocacy footprints in their host countries. So these organizations actually had sensed that, had taken the warnings, I think, that were circulated in the media quite seriously, and had already started pre-positioning supplies, already started thinking about the response, were already organizing protests, were already kind of on the ground. And so when we're comparing, let's say, the formal humanitarian response to the diaspora response, we see that they were able to be much more practically active much quicker. And I think we can all say, I mean, at least even for my own community and my own personal experience as well, that there was a global outpouring of support for the situation in Ukraine. And I think what also makes organizations very unique is the extent to which they were able to leverage that. Kind of in a way like never before, people were very willing to donate money to local organizations and to see those leveraged. And so in our study, we did find that within the first few weeks, we thought that the 60 organizations had raised around $60 million US dollars, which was actually the total appeal for the health cluster in that period. So just like a huge outpouring of support. And I think a diversity in partnerships. I mean, I'm sure you'll say, Andrii, but I think that connection with national NGOs and CSOs is also quite unique.
Yeah, definitely. I would return to the point where Ukrainian diaspora was a bit in a different situation because the, how do you call it, crisis, but we call it in Ukraine, war in Ukraine, has emerged like in 2014. And since that, Ukrainian diaspora was actively working in helping to east part of Ukraine, internally displaced people in Ukraine, and other humanitarian issue which arise with this with the war. And because economically Ukraine also went down, so we need to help different regions to Ukraine to make it work. So in that way, it was different. So also we were in some way mentally prepared, what we didn't have before. In 2014, we already knew that we are in a stage of war. And everyone on the backstage already understood that in some days it will arise and we need to act. So basically for 8 years, we've been doing some kind of preparation. Last year, just before the war, we were like actively been getting prepared over there to get to the level where we can react very fast. Basically in December 2021, we formed a group of people which been actively think tankers on what we're gonna do tomorrow if the war will arise. That of course will help us a lot to react. And that's the first one. The second one is we've been working, I'm talking about Danish diaspora. We've been Danish humanitarian NGO, Bava Ukraine, which act on behalf of Ukrainian diaspora in Denmark. We create a network of local partners we've been working with through all Ukraine in different regions. And that's actually, I think it was a key role of them in helping Ukraine at the period of time. You know, in the first 3 weeks, for example, when a bigger player like Red Cross has been just starting their machine, we've been just sending the direct help right away.
Thank you very much, Andrii. And I don't know if maybe Dina, you have something to complement to that, especially in partnership.
I was just add to what Victor said. Recently in Ukraine, we say that this is a 3 months war, that 3 months of 8 years war that lasts for 400 years already. And that's actually what differs this crisis from some different in other areas, because Ukrainians are, well, all set and prepared for this before that. And they had all these partnerships set all over the country, even with private sector and with larger NGOs, and those who had experience working with international agencies, they already were alarmed about that. And for example, I live in Kiev Oblast. I had all my stuff packed 2 weeks before. I had gasoline in my car. I had all the documents set because we were ready. And so were the NGOs that were working since 2014 and all the diaspora, Ukrainian especially, because maybe some of you don't know, but those who are diaspora, Ukrainian diaspora now, they are diaspora because we have this war going for ages. Yeah.
Thank you very much, Dina. And it would be interesting to hear a little bit more concretely as well what were the modus operandi and how did actually Ukrainian diaspora organization were able to support Ukrainian needs? And maybe also to relate to this discussion this morning, what would you describe as their value added or their specificity as a diaspora organization compared to other institutional humanitarian actors like the UN or INGOs? Maybe starting with you, Andrii.
Mm-hmm. I think as we're talking about Denmark, we're based in Denmark. Ukrainian diaspora over there was like this engine which work in order to receive a huge humanitarian response from private business as actors and transferring to Ukraine to the points where it was most needed. So basically in a first week or weeks of the war, we contact our network in Ukraine and see what was a possible way to transport the humanitarian aid. For example, at the beginning, it was quite hard even to bring it to Ukraine because of transportation issues, also very big outflow of Ukrainians from Ukraine, some issue with their allowance and other things. So mainly in the first week of the war, we delivered to the hub warehouses in Poland, which were on the border with Ukraine. Then we crossed the border, we start delivering to Lviv, Chernobyl, west region of Ukraine, Rivne. And then when the situation were changed, we start deliver more and more. Right now we are delivering to Zaporizhia, which is on a front line. We deliver to Kharkiv, which is on front line as far as possible. And recipients of humanitarian aid, first it's hospitals where they need a lot of medical equipment, they need necessary stuff. Also local NGOs whom we know from our previous work. The main request as of now is mainly it's a food. Also during the war, during the winter season and beginning of the spring, we deliver a lot of clothes, warm clothes for internal displaced people and refugees who's been running out of their cities which were bombed. That was their main response.
That's really super interesting. And maybe Dina, also you can complement because you've been also engaging with a lot of Ukrainian DOs.
In the previous research, we had a case study in 2021. So I was the consultant from Ukraine that was doing the research and all the interviews. We figured out that there are 3 types of Ukrainian diaspora organizations, basically. So one of them is volunteer groups that are not registered anywhere, but they just respond to all that happens. The second one is large diaspora organizations that have been existing like for ages, like the Ukrainian Congress and Association of Ukrainians in Canada. So they were existing since previous century. And the third one is basically organizations that got registered, as Emily said, they were registered after 2014, and they were, we call it like the new generation of diaspora organizations. So the latest basically have very good knowledge of Ukrainian context because these are mostly expats, like Ukrainian expats living abroad, like Andrii. They're recently from Ukraine. They know all the stuff, like how banks are working, how logistics is working and everything. So there's like a huge added value of knowing the local context. And also they have existing working with partnerships with local hospitals, with ministries and everything, because they were working with oncological hospitals, children hospitals in different regions, even before the war, even before 2014, because they were supporting them. And as Andrii said, it was preparedness and early warning, because they already had all the strategic sessions before. I'm also working as a facilitator with a civil society in Ukraine for more than 12 years already, so I'm into the strategic sessions of civil society in Ukraine. And during the recent year, when we're doing the SWOT analysis, and one of these threats that was like top 3 is war being expanded in Ukraine. That's why they all were planning for that in advance.
Thank you, Dina. And Emily, is there anything else you've seen in the recent real-time review in terms of specificities of DOs?
Yeah, I was just trying to think in my head how I would summarize them. And I would say maybe there's kind of 3 types of response that we're seeing. I think that's a bit particularly, and maybe linking to this morning's panel. The first is the stuff. And then I think there's the fundraising, and then there's the issue of the civilian defenders and kind of military support, and where humanitarian support kind of crosses the bounds of what our typical humanitarian principles are. So on the stuff, I think what's really interesting is diaspora organizations were in an interesting position where, just people, even with no relationship to Ukraine, wanted to do something, and so giving things was an easy way to do that. And diaspora organizations, especially those in Europe, were collecting stuff and sending it to Ukraine and then organizing that to move across the border. And then it was being distributed in community organized humanitarian hubs, which is a response type that is simply not possible for larger NGOs to do, mostly because when it's going to a humanitarian hub, the control of that stuff and the accountability, I guess, is no longer there. We're not really sure where it's going. So that's an interesting approach, and because it was so quick, I think that it did fill a gap in the need. And I think we're starting to see, of course, that the staff is less relevant now, like the untargeted assistance. For the next, I think the fundraising is really interesting because the fundraising is all private donations. There's just an immense amount of control that organizations have on how the money is spent in a way that INGOs simply don't have. So I think, Andrii, like you had mentioned, in some other organizations that we studied in the real-time review, we're able to just have people reach out to them from hospitals or from different oblasts and say, we need XYZ, okay, we can allocate some of our money to that because it's just given as general donations. On the military support, I mean, honestly, it's not in a typical humanitarian response, but it's something that's almost impossible to ignore, is that this humanitarian crisis is the result of an international conflict. And as a result, kind of the civilian defender forces are a huge part of that in Ukraine and a big part of, I think, the global mobilization to help Ukraine. They're a very sympathetic group. And as a result, a lot of DOs have really focused on providing support directly to them, whether that's through food, medical supplies, military equipment, not necessarily weapons, but protective equipment, or money that is there and brings up that tension in how do DOs and the humanitarian system work together.
I can add a little bit like to the background of that. So the reason why DOs are doing this, like there are 2 main. First is that this is not like the regular crisis. This is an issue of national identity for many of the diaspora organizations. And we just were talking about this, that all the humanitarian system was created after the Second World War. That's why we don't have any, even the research of how this neutrality was managed during the Second World War. So for Ukrainians, it's kind of personal, like very personal. And the second is, I think it's in the case study because we were mentioning it. So Ukraine didn't have any experience with humanitarian crisis since the beginning of its independence in 1991 as a separate state. And the only experience that Ukraine had with crisis was during the Soviet time, and it was the Chernobyl disaster in 1986. So basically all Ukrainians remember about humanitarian crisis was related to Chernobyl. And when we had this, when growing as a kid, I remember that as kids of Chernobyl, we had a lot of humanitarian aid coming to Ukraine. We were, you remember maybe, we had pens, toys and everything. It was free of charge and it was called humanitarian. So for Ukrainians, when the war started in 2014, everything that is free of charge coming from abroad was called humanitarian. That's why they sometimes mixing it because they are not aware about humanitarian principles, and everything is what is free of charge is called humanitarian. So coming back to the morning discussion, it's an issue of vocabulary and what you're using, like which words you're using.
Thanks, Dina. That's really.
Just a correction. There was another humanitarian crisis in Ukraine. It was the flood in Ukraine.
Yeah, the floods actually happening every year in spring. Yeah, that's true. Yeah.
Great, thank you, Dina, for the clarification. And maybe also related to this morning discussion, how do you see the Diaspora organization engagement with institutional humanitarian actor in Ukraine? Is there some form of collaboration, cooperation, or just information sharing? Maybe Andrii, from your perspective, how would you describe it?
Yeah, we built on that. I think since COVID time. We tried to make a very deep cooperation with the health sector. We signed a memorandum of cooperation with Ministry of Health, and now we're on the way of signing memorandum with Ministry of Social Affairs in Ukraine. So that's one thing which is going on the top level. If we're going down, we cooperate with local authorities like regional authorities. Helping the whole area of region through local authorities, because they really know what is the need over there. When we come with a truck of humanitarian aid, for them it's really a very fast way to distribute it and to show us where it goes. So we're using them as well. The last one would be probably on the lowest level when we send direct humanitarian aid to hospitals, which need it. So we are working on a very different level, and it's only from like country or from government side. Also through cooperation with DEMAC, we've been introduced to health cluster and food clusters, so we also get a better understanding how the system works. Actually, before that, we even didn't have an idea what that they are there, that they're present, what is their function. Since that was a very big finding for us, and also help to understand us what is the main actors on the ground.
Great. So a lot of collaboration with local authorities, government, and starting to engage also with the cluster. And maybe Emily, on the cluster side and the kind of institutional humanitarian actor side, based a bit on the interview you had, did you see some interest to engage, or do you see some form of some worries or some resistance?
Yeah, it's interesting because, again, relating to the panel this morning, I do think there is just this huge kind of bureaucratic impediment to cooperation in a way. Like, clusters are used to going in, like OCHA is used to going into crises, setting up, being the big man on campus, having the clusters and working with organizations that like instinctually know how they work. They know what a 4W is. They know like what the kind of, typical agenda of a cluster meeting is, what contributions are welcome in that space and which ones are not. And that was unfamiliar to most organizations. And so I think that there is that impediment where there is that kind of that gap, and there's not a lot of time, or maybe even clusters or institutional actors don't feel like it's their role to explain that to people who want to be active in the response. I think there is an interest in engaging, because I think it is obvious that a lot of diaspora organizations have been able to mobilize an incredible amount of resources and are responding. So that's visible. Maybe an unintended overlap is now, especially that INGOs are establishing their operations a bit more, is that most likely diaspora organizations and INGOs have the same local partners. Which is, and yeah, you're nodding, like they're playing by completely different rules. So if a formal, like a large INGO has a local partner, they are seeing them as an implementing partner has like a very firm contract and very firm accountability and financial standards set by their ultimate donor, ECHO or any other bilateral donor. And then on the other side, you have a partnership with a diaspora organization who's like, oh, where do you think the needs are? Go ahead and respond in that way. And so I think in some way, their response together is actually some sort of, let's say, collaboration, but through a national NGO that isn't really telling both sides of the story to each of their partners, which I think is fair enough. But somehow diaspora organizations fill that gap where, you don't want to go through a contract amendment. you don't want to necessarily be held to whatever donor standards. You just want to be able to respond to a need that you see, and that is actually maybe needed in the community and needs quick decision making. So that's...
Dina, do you want to complement that?
Yeah, I would agree that suddenly, because the humanitarian system in Ukraine was set in 2015, so not even 2014, but in 2015. And they